Hi, welcome back to Herbal Bunny's Pharmacy, where we talk about using nature's pharmacy instead of big pharma. Today's topic is going to be on estrogen dominance, why it's just kind of being brushed off as being normal. So if you're struggling with heavy periods, painful cramps, bloating, fibroids, endometriosis, PCOS, PMS, mood swings, and trouble getting pregnant, this is the topic for you. So what is estrogen dominance? A lot of people think that estrogen dominance means that you just have the sky-high estrogen, but it really means that your estrogen is higher than your progesterone. Our estrogen is a very powerful hormone. It helps to build up our uterine lining, it helps with breast development, it influences our mood, our skin, our metabolism, and other things, but when it's too high or not properly in line with our progesterone, it can become a major troublemaker. So we'll start to see different conditions. Some of the many conditions that we find with high estrogen or estrogen dominance can be fibroids. Fibroids are non-cancerous tumors that grow within the uterus. So when estrogen is high, it tends to feed the fibroids and they can grow bigger or cause heavier bleeding, pressure, and pain. When I was pregnant with my son, I had some fibroids that were a certain size and they kept measuring it every time I went into an ultrasound, and they said once I give birth that once my estrogen starts to go down, the fibroids should start to shrivel. But for many women, we start to see these fibroids developing even outside of pregnancy. In this condition, the uterine tissue grows outside of the uterus, and estrogen stimulates this tissue to thicken, bleed, and become inflamed, causing severe pain and sometimes infertility. Another condition that many women suffer with, I also suffered with, was PCOS, which is polycystic ovarian syndrome. While PCOS is often associated with high androgens, many women have high estrogen and low progesterone due to not ovulating. And this leads to estrogen rising and worsening symptoms like cis irregular periods and weight gain. Another condition that I had was uterine polyps. Now, I was able to actually reverse some of these, but some of them I did have removed. But these are just little small growths that grow right on the uterine lining, and they thrive in a high estrogen environment and can lead to irregular bleeding and fertility issues. Another symptom is severe PMS, which I did have, or PMDD. These are mood swings, you have breast tenderness, anxiety, which I had tons of. Irritability often links to these spikes in estrogen, and in the second half of your cycle, if your progesterone is too low and not in balance with it, then these symptoms can really hit hard. Breast tenderness and lumps. I didn't really have a whole lot of that except for when I was pregnant, but estrogen stimulates breast tissue growth, and too much of it can lead to pain and non-cancerous fibroid cyst in the breast. Infertility and miscarriage is another symptom of having high estrogen. Without enough progesterone to hold the uterine lining in place, the high estrogen can create a hostile environment for implantation and increase the risk of miscarriage. Very unfortunate. Other signs that you may be having high estrogen include long, heavy periods, painful cramps, breast tenderness, bloating, mood swings, anxiety, irritability, weight gain around the hips and the thigh area, fatigue, and brain fog. Headaches and migraines, specifically before your period, can also be a sign of high estrogen, also trouble sleeping. What causes this high estrogen? Let's look at why it becomes so dominant in the first place. Lack of ovulation. If you're not ovulating, that means there's no progesterone, and that is leaving estrogen to be the dominant one. Poor liver function. If your liver is not detoxifying the excess amount of estrogen, and if it's sluggish and the estrogen starts to build up, then it's released back into the body. It's not being cycled out of the body. It's being recycled. We don't want to recycle our estrogen. We want to get it out. Constipation. If estrogen is not being eliminated properly through your stool, again, it's being recycled back into your body. We're not recycling. Recycle is good, but not with estrogen. Xenoestrogens, which is what I talked about in the previous video, and these are coming from toxins from plastics, our skincare products, our household cleaning products, and our air fresheners and things that we're putting in our environment. Hormonal birth control. I was on birth control for 7 years because I wanted to regulate my hormones, not knowing that it was jacking with my hormones. So these synthetic estrogens can overwhelm your body and suppress your natural hormonal rhythms. Chronic stress. High cortisol stills progesterone, worsening estrogen dominance. So if we're constantly stressed out, then our cortisol levels are going to skyrocket, and estrogen just stays right there waving high, and our progesterone just... Or diet. Excessive amounts of sugar is horrific for our hormones. So if we're trying to balance our hormones, we need to make sure we cut out the sweets, okay? Alcohol, dairy, and processed foods can also spike estrogen, particularly if they have a lot of those estrogen mimicking compounds in them. There are some natural ways that we can rebalance our estrogen. We want to support our liver detoxification, so we need to eat foods that are high in our cruciferous veggies like broccoli, kale, and Brussels sprout. Drinking enough water so that we can stay regular, and eating fiber to make sure we're flushing out those excess amounts of estrogen. Seed cycling, which I spoke about in a previous video, is like 2 or 3 videos back. I highly recommend you guys go and watch that. But seed cycling helps to support estrogen and progesterone through your entire menstrual cycle. Eliminate xenoestrogens by switching to natural products and avoiding plastics. We need to lower our stress levels, and this is by meditation and getting some yoga in, getting our body moving, going outside, grounding ourselves, doing journaling. Anything that we can take ourselves kind of out of reality for the moment. We need to take time for ourselves, ladies. So find something that makes you happy. Reading, gardening, yoga, nature. I love going into nature. It's so healing. Using herbal remedies such as Vitex, which I highly recommend because that's what I was taking when I was trying to balance out my hormones, and I ended up pregnant. You could also take DIM, which is found in your cruciferous vegetables, milk thistle to help with your liver detoxification, and also I like to take maca and dong quai. They help to also regulate your hormones. Remember, ladies, our body wants to heal, so once we remove what is harming it and give it what it needs, it responds beautifully. And estrogen isn't the enemy, it just has to be in the right balance. So when it's too high and out of control, we have the control to be able to put it back into balance. All right, you guys, I hope this video gave you guys some hope and some education. Video content is what you guys are enjoying. Please consider liking, subscribing, and following me on any of the other social medias that I have, like on TikTok or Instagram or Snapchat, and I'll see you guys in the next video.